Blood-borne pathogen and risk management. Introduction. The transmission of blood-borne pathogens in the healthcare setting has become a matter of increasing public interest and concern over the past number of years. There have been several reports of healthcare workers infected with blood-borne pathogens who had been involved in exposure-prone procedures. There have also been reports of infection being transmitted due to contaminated equipment. A pathogen or infectious agent is a biological agent that causes disease or illness to its host. The term is most often used for agents that disrupt the normal physiological of a multicellular animal or plant. However, pathogens can infect unicellular organisms from all of the biological kingdoms. There are several substrates and pathways whereby pathogens can invade a host. The human body contains many natural defenses against some of the common pathogens in the form of human immune system and by some helpful bacteria present in the human body's normal flora. Some pathogens have been found to be responsible for massive amount of casualties and have had a numerous effect on affected groups. Today, while many medical advances have been made to safeguard against infection by pathogen through the use of vaccination, antibiotic and fungicide, pathogen continues to threaten human life. Social advances such as food safety, hygiene and water treatment have reduced the threat from some pathogens. On the other hand, the wrist is a complex set of bones connecting the lower arm with the hand. It provides considerable movement of the hand. The wrist allows the hand to rotate up and down. It also allows the wrist to rotate side to side. The wrist consists of 8 bones called carpal bones arranged in a complex pattern. The carpal bones interconnect the metacarpal bones of the hand with the radius and ulnar bones of the forearm. The mass that results from this bone is called the carpus. The carpus is rounded on its proximal end, where it articulates with the ulna and radius at the wrist. The carpus is slightly concave on the palmar side, forming a canal known as the carpal tunnel through which tendon, ligaments and nerves extend into the palm. Its distal surface articulates with the metacarpal bones which are joined to the carpus by palmar carpometacarpal ligaments. Now we have the spread of blood-borne pathogens. Blood-borne pathogens such as bacteria and viruses are present in the blood body fluids, can cause diseases in humans. The blood-borne pathogens of the primary concern are hepatitis B, hepatitis C and HIV. These diseases and other blood-borne pathogens are spread primarily through number 1, direct contact. Infected blood-borne fluid from one person enters another person's body at a correct entry site, such as infected bone splashing in the eye. Number 2, indirect contact. A person's skin touches an object that contains the blood or body fluid of an infected person, such as picking up soil, dressing contaminated with an infected person's blood or body fluid. Number 3, respiratory droplet transmission. A person inhaled droplets from an infected person, such as through a cough or sneeze. Number 4, vector-borne transmission. A person's skin is penetrated by an infectious source, such as an insect bite. Now we have risks of transmission of hepatitis B virus, that is HVV. nature of the risk of transmission. The most efficient method of HBV transmission is by percutaneous exposure to the infected blood. Transmission by saliva has been documented only after percutaneous exposure. Now we have duration of the infection. After acute hepatitis B virus infection, the outcome of infection can follow one of the two courses. Most infection in adult, that is 90 to 95%, are self-limited symptoms, last for up to several weeks, are followed by spontaneous recovery and development of immunity to reinfection within 6 months. However, between 5 to 10% of adult and more than 90% of babies who become infected develop chronic infection with the virus and become carriers. The majority of such persons remain infectious for their lifetime. Now we have severity of the infection. Approximately 1/3 of those infected have no clinical symptoms and are unaware of the infection. A further 1/3 of patients show sign of illness and develop symptoms between 4 and 12 weeks after coming into contact with the virus. Symptoms include loss of appetite, malaise, nausea, and influenza. Another 1/3 develop more serious symptoms, for example, vomiting, abdominal pain, and jaundice. Now we have the risk of transmission of hepatitis C virus. The hepatitis C virus was first identified in 1989. Satisfactory tests to identify it were not developed until 1991. Thus, knowledge about the diseases at this point in the time is not complete. Now we have nature of the risk of transmission. The major route of transmission in healthcare is by exposure to infected blood and body fluids. Duration of the infection. The average incubation period of hepatitis C following infection by a blood transfusion or needle-stick injury is approximately 7 weeks. American studies have shown that the majority of the patients with acute hepatitis C virus infection develop chronic hepatitis C virus infection with a persistent bulimia. Severity of the infection. Among persons with acute hepatitis C virus infection, 25% or fewer have symptoms of acute hepatitis. It is estimated in the US population that 67% of patients have persistently elevated liver enzyme, 26 to 50% develop chronic active hepatitis, and depending on the population, 3 to 26% develop cirrhosis within several years of becoming infected. The risk of transmission of human immunodeficiency virus, so-called HIV. Now we have nature of risk of transmission. The major risk of transmission of HIV in the healthcare setting is associated with percutaneous exposure to blood or blood-containing body fluids contaminated with HIV. Transmission can occur rarely through mucous membrane. Now we have the duration of the infection. Patients are presumed to be infectious early after the onset of HIV infection and to remain infectious for the rest of their lives. Infectivity may be high during the initial period after infection and again as the degree of immunodeficiency worsens. Now we have the severity of the infection. Within several weeks to the several months after infection with HIV, many people develop an acute self-limited mononucleosis-like illness lasting a week or two. Infected people may then be free of symptoms for many years before progressing to clinical immunodeficiency. The epidemiology of HIV has changed more recently with the advent of more effective treatment, and the longer-term survival has changed markedly since September 1995. Death rate in Europe in 1998 were less than a fifth of their previous level largely due to new treatment combinations. Now we have precautionary measures. Follow standard precaution to help prevent the spread of bloodborne pathogens and other diseases whenever there is a risk of exposure to blood or other body fluids. This precaution requisite that all the blood and other body fluid be treated as if they are infectious. Standard precaution includes maintaining personal hygiene and using personal protective equipment, so-called PPE, engineering control, work practice control, and proper equipment cleaning and spill cleaning up procedures. Now we have guidelines to prevent infection. Some of the guidelines for prevention of bloodborne pathogen are as follows. Number 1, avoid contact with blood and other body fluids. Number 2, use CPR breathing barriers such as resuscitation masks when giving ventilation. Number 3, wear disposable gloves whenever providing care, particularly if he or she may come into contact with blood or body fluid. Also, wear protective coverings such as a mask, eyewear, and gown if blood or other body fluid can splash. Number 4, cover any cuts, scrapes, or sore and remove jewelries including rings before wearing disposable gloves. Number 5, change gloves before providing care to a different victim. Number 6, remove disposable gloves without contacting the soiled part of the glove and dispose them in a proper container. Number 7, thoroughly wash the hand and other area immediately after providing care. Use alcohol-based hand sanitizer where hand washing facilities are not available if hands are not visible swell. Now we have wrist management. The wrist joint is a type of pivot joint moving in a relation to the forearm bones, the radius and ulna. However, most of the wrist movement is result of the carpal bone moving relative to the radius. The head of the radius bone is concave in shape, allowing the carpal bone to rotate and pivot with the end of the bone. Now we have section of the wrist joint. Wrist joint can be classified into the following manner. Number 1, proximal wrist joint, intermediate wrist joint, and distal wrist joint. Now we have proximal wrist joint. Proximal wrist joint has 2 segments. Number A, first segment is formed by pivot joint between radius and ulna. Head of distal end of ulna is covered with smooth cartilage which lies against ulna notch of radius bone. Number B, second segment is link or joint between distal end of radius and part of ulna with proximal row of 3 carpal bone. Now we have intermediate wrist joint. Intermediate wrist joint is a link or joint between proximal row of carpal bone and distal rows of carpal bones. The joint is also known as intercarpal wrist joint. Number 3, distal wrist joint. The distal wrist joint, commonly known as distal radio-ulnar joint, is a pivot joint located between bones of forearm, that is radius and ulna. This joint is an ellipsoid joint formed by the radius and the articular disc proximately and proximal row of carpal bone distally. Now we have the function of wrist joint. The function of the wrist joint are as follows. Number 1, the wrist joint link hand to the forearm. Number 2, wrist joints support hand movement like flexion, extension, abduction, adduction, lateral tilt, supination, and pronation. Number 3, wrist joint protect tendon and nerves. Now we have wrist joint dislocation. Dislocation is a separation of 2 bones which is linked to each other. Isolated dislocation or carpal bone is rare, since wrist joint dislocation is often associated with fracture of one of the wrist joint bone. The causes of the wrist joint dislocation. The wrist joint dislocation is caused by trauma, and following are the causes of the trauma. Number 1, automobile accident injury. Number 2, work accident. Number 3, sport injuries. Number 4, domestic fall. Number 5, sleep and fall on slippery surface. After this, we have symptom of wrist joint dislocation. Some of the symptoms of wrist joint dislocation are as follows. Number 1, wrist joint pain. Number 2, restricted wrist joint movement. Number 3, abnormal sensory symptom like tingling and numbness. Now we have the treatment for wrist joint dislocation. Treatments are: number 1, conservative treatment. Number 2, medication. Number 3, physical therapy. Number 4, interventional pain therapy. Number 5, close reduction. Number 6, surgical treatment. Now we have wrist fracture. A wrist fracture is a medical term of a broken wrist. Although a broken wrist can happen in any of the bones which connect the wrists, by far the most common bone to break is the radius. This is called a distal radius fracture. Fracture that breaks apart the smooth joint surface, or fracture that shatter into many pieces, may make the bone unstable. These severe types of fractures often require surgery to restore and hold their ligament. An open fracture occurs when a fragment of bone breaks and is forced out through the skin. Now we have causes. A wrist joint fracture occurs from an injury such as falling down onto an outstretched hand, severe trauma such as car accident, motorcycle accident, or fall from a ladder cause more severe injury. Weak bone, for example in osteoporosis, tend to break more easily. Now we have signs and symptoms. When the wrist is broken, there is a pain and swelling. It can be hard to move or use the hand and wrist. Swelling of a bone out of place can make a wrist appear deformed. There is often pain right around the break and with finger movement. Sometimes the finger tingle or feel numb at the tips. Now we have treatment. Treatment depends on many factors, including: number 1, type of fracture, whether it is displaced, unstable or open. Number 2, age, job, hobbies and activity level. Number 3, overall general health. Number 4, presence of other injuries. Now we have wrist sprain. A sprain is an injury to a ligament. Ligaments are the connective tissues that connect bone to bone. They could be though as tape off that holds the bone together at a joint. The most common ligament to be injured in the wrist is the scapholunate ligament. Sprain can have a wide range of severity. Minor sprain may have minimal stretch of the ligaments, and more severe sprain may represent complete tears of the ligaments. Now we have causes. Wrist sprains are common when a person falls. The wrist is usually bent backward when the hand hits the ground. Now we have signs and symptoms. After injury, the wrist will usually swell and may show bruising. It is usually painful to move. Now we have treatment. Treatment may range from wearing a splint or cast to surgery. Surgery may consist of arthroscopic or open surgery. Arthroscopic surgery is performed through small, that is 3 to 4 millimeters, incision in the skin. A camera and other special instruments are placed inside the wrist to confirm the diagnosis and potentially treat the ligament injury. Some injuries require open surgery where an incision is made to appear the ligament. Some injuries require open surgery where an incision is made to repair the ligament. A variety of repair methods exist, which could include metal pins, screw and other specialized devices. Patients are usually placed in a splint or cast that may need to remain on several weeks after surgery. Now we have conclusion. The risk of transmission of bloodborne pathogens in the healthcare setting has become a matter of increasing concern in the recent years. A pathogen or infectious agent is a biological agent that causes disease or illness to its host. The term is most often used for agents that disrupt the normal physiology of a multicellular animal or plant. However, pathogens can infect unicellular organisms from all of the biological kingdoms. On the other hand, the wrist is a complex set of bones connecting to the lower arm with hand. It provides considerable movement of the hand. The wrist allows the hand to rotate up and down. It is also allows the wrist to rotate side to side. The wrist consists of 8 bones called carpal bones arranged in a complex pattern.